Of measles here in the United States, and Massachusetts has seen only a couple of cases in the past 5 years, but health experts say that could change. It could change quickly. So here to talk about that is Dr. Shira Daron, the Chief of Infection Control Officer at Tufts Medicine. It's great to see you, Dr. Daron. So let's start with the current outbreak. It's not here, it's in the state of Texas. So let's put the numbers up on the screen, and it's in a different, the state is huge. It's in the western part of the state. You can see 159 infections so far. 22 people are hospitalized. There has been one death. It's a child. Is it under control? Do you know?
No, it's not yet. Measles is the most contagious virus we know. And when it gets a foothold in an under-vaccinated community, it spreads like wildfire. The number of cases that we know about, likely a pretty dramatic undercount. Parents are not necessarily even bringing their children with symptoms to the doctor to be tested. So it's likely going to keep circulating for some time.
So given that, let's compare the vaccination rates. In Texas, for example, it's over 90. It's 94.3% of kindergartners. They are vaccinated against the measles. In Massachusetts, that number is over 96. Is the rate in the Bay State high enough to protect us from an outbreak?
Well, if you want to be very technical about it, the herd immunity threshold, or the percentage of a population that needs to be immune to prevent an outbreak, is thought to be 95%, which really reflects how very contagious measles is. But it's not the state kindergarten vaccination rate that matters. What we're seeing in Texas and what we've seen in other large outbreaks over the years is that it's pockets of under-vaccination, specific neighborhoods, communities, or schools. If they have lower vaccination rates, that's enough to fuel an outbreak that can affect hundreds of people.
Got it. That's a great distinction. So with the measles, if you are already vaccinated, do you have anything to worry about, or are you fully protected?
Well, there's some good news there. If you've had measles, and we assume that anyone born before the age of before 1957 has had measles, if you've been vaccinated, ideally with 2 doses, but even 1 dose is 93% effective, or if you've been tested for immunity and found to be immune, that immunity lasts for life. There are no boosters needed for measles. Now, if you're not sure if you're immune and you're going to be somewhere with an outbreak, then it's worth talking to your doctor about what you might need to do to shore up that protection.
Dr. Daron, great advice. Great to see you again.
You too.